Hi there, this is Dr. Paul. Thank you for tuning in to yet another video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about something called a snore guard. Now, a lot of us inherently may suffer from something called sleep apnea. Sleep apnea is a condition where when you fall asleep, the floor of the palate or the soft palate can actually collapse into your trachea or windpipe, hence causing you to snore. To a lot of people, they snore and they still continue breathing, but there are a few number of people where the tissue actually fall so heavily or so often and obstruct the windpipe that they actually suffocate or choke themselves multiple number of times at night. So going for something called a polysomnograph or a sleep study is a good way to figure out what kind of apnea you have. Now, if you have apnea and they diagnose you with, say, mild moderate, severe apnea, there are actually different alternative treatments out there. For mild and moderate apnea, there are some things called snore guards where what they do is they bring your jaw forward. Now, for every cubic millimeter that your jaw is brought forward, the amount of air that increases into your windpipe is 4 times more. So that's the relation. So it's not that every millimeter or every cubic millimeter of measurement that your jaw goes forward, there's only that cubic millimeter of air that's entering your windpipe. Is actually 4 times more. Now, this is hugely beneficial for people who are very claustrophobic and who can't wear their CPAP, especially if it's mild or moderate form of sleep apnea or sleep apnea. This is an alternative. Similarly, if you're someone who travels a lot and you are away on business quite a bit, lugging a big CPAP machine might be a little too much, but a snore guard can be easily transported along with your toiletry case, and you can always use it whenever you're out and about. But once you come home, if you really need to, or your doctor has told you that you really need to use a CPAP machine, you can get back to using that. What happens these days is if you go to a doctor and they diagnose you with hypertension or high blood pressure, they give you some pills to combat that. All medications have some form of side effects. So when you go back to the doctor, they see that you have another side effect or you have another symptom, and they give you medication for that. So you kind of end up becoming on this endless supply of medications, wherein your cause of high blood pressure might just be sleep apnea. So that being said, not all high blood pressures result from sleep apnea, but all sleep apneas result in high blood pressure and a few other symptoms or conditions. So telling or asking your doctor, hey, could I go for a sleep study or a polysomnograph, is the least invasive way or the best way to make sure that someone's making sure that you don't have sleep apnea. And if you do have sleep apnea, they diagnose you or they tell you what kind of sleep apnea you have, and then you can talk to your dental professional about that, and they can offer you a snore guard or the like. Now, there are different kinds of snore guards out there. There's the TAP appliance, there is the Panthera, there's the Damien appliances. There are so many different kinds of appliances. So once you talk to your doctor about the fact that you have sleep apnea, that this is what they've diagnosed you as, then the dentist can actually tell you all your options, and you can pick something which you think that you would favor more than the other. I hope this has shed some light into sleep apnea and the different alternative methods of treatment out there. If you have any questions, you can reach out to us via email or give us a call, and we would be delighted to help you. Thanks for watching.